Hello and welcome to For Your Health. I'm Mark Crosby of Quincy Access Television. Thank you so much for joining us. For Your Health is a program that, basically does just that, provides information for you and for your own well-being. Speaking with me today from the Quincy Health Department is Caitlin Kirby. Welcome back. We should say Kirby because you are recently married, so congratulations.
Yes, thank you very much. I know I've been a PICO for 30 years, so it's a tough change, but yep, Caitlin Kirby now.
And I almost, I'm glad that I didn't call you Caitlin Pico, that I actually remembered to call you by your new married name. So once again, congratulations.
Thank you.
Always a pleasure to have you in. This program we've done, I guess, every year since you've been at the Quincy Health Department because there are basic information points that remain constant from year to year, but there's some things that change. We are talking about the seasonal flu, and we should say that though precautionary measures remain the same, the strain differs from year to year.
It does. Yeah, so each year when we do these episodes, we stick to the same information in regards to like what is the flu and the symptoms. But as you said, those strains of COVID, they change annually, the vaccines, in order to cover the strains that are currently circulating or expected to be circulating in the U.S. So we'll definitely get into some of that information. And we always like to recap all the other points, just in case it's a viewer's first time watching.
Absolutely. And we should also mention that at this point in time, though we will be talking about the flu this fall season into the winter, there is also RSV that people could potentially get, and COVID is still around.
And every year, it's very tough this season, fall season. That's when the changes in the weather, you start to see a lot of respiratory illnesses. So as you mentioned, those three, it's very hard to rule it out. So if you're having symptoms, we'll get into prevention a little later in this episode. But if you're sick or experiencing symptoms, definitely potentially test for COVID if you're able to, but definitely you're going to want to keep away from others and help try to reduce the risk of spreading it.
And I just heard a story, and I know we'll probably get to this in the program, but a story about the test kits for COVID. If you read the expiration date, they all have expiration dates, and if you read the expiration date on the package, sometimes those dates have been extended, so you can actually check that particular package, correct?
Yes.
Even though the date might have passed.
Yeah, so a lot of times on the manufacturer, so whichever, it depends on what COVID kit you're using, of course, but if you look on that manufacturer's website, you're able to plug in the lot number, which you can find right on the box for the test kit. And that lot number, when you enter it, they would give you the extended date if there is one. If you're having trouble locating that on a test kit at home, or you don't know how to do that, you could always either call your local Board of Health or stop by your local Board of Health, and I'm sure the medical staff there, the nurses, would be happy to look up that information.
Let's talk about the flu for the 2023-2024 season. So let's start with an outline. That's always the best way. So I believe definition is always, and clearly you do too, is the best way to begin a program. So what is the flu? We'll be talking about common symptoms, how the flu spreads, what's new this flu season, and the projected flu vaccine supply for 2023 into 2024, and prevention, which even though it's last is the most important.
Always our favorite topic. I say that in every episode.
If you can prevent before you get this or anything else, that's simply the way to go. You'll be a lot healthier.
For all health conditions, prevention.
So what is the flu? A lot of times people will refer to it as influenza.
Yeah, so influenza, flu is actually like the nickname for influenza. So it's a contagious respiratory illness that is caused by a virus. And it infects the nose, throat, and sometimes your lungs. So where it is a virus, a lot of times you just have to let it run its course. Definitely you can check in if you're very ill with the flu. Definitely check in with your healthcare provider so they can, if you do need any assistance or any medications to help with symptoms, they'll be able to help you with that. So these influenza viruses, they can cause mild to severe illness, and this can lead to hospitalizations and even death in some cases. I shouldn't say most cases.
Well, if you have certainly pre-existing conditions, getting the flu would maybe make you more susceptible, correct?
Yeah, so definitely there are certain risk factors. So if you have certain health conditions that make you immunosuppressed, so your body can't fight off infections as well, for example, diabetes or a lot of heart conditions. You want to make sure, we'll get into our prevention, but if you are at high risk, make sure you're getting that flu vaccine every year. And it's also important to know there are two main types of influenza viruses, and that's type A and type B. And those are responsible for the seasonal flu epidemics every year.
And how do we know here in the U.S. what strain we would be receiving? It's how it's hit in a different country, correct?
Yeah, so they kind of monitor how this is hitting in other countries, because of course their seasons are different than ours. So their flu season hits at a different time. The CDC monitors all of this flu activity in different countries, and that's how they kind of predict, and that's how they decide what variants are going to be covered in the current vaccines.
As we look at common symptoms, you can have all of these or just some of these. I guess it would vary on the individual.
Yes, yes. And as we go through common flu symptoms, I'm sure a lot of our viewers have had the common cold throughout their life. But you'll notice with these symptoms that they also they can mimic RSV, they can mimic COVID. So it's just important to know if you're sick with any of these, make sure you're looking into it to see what virus you might have. And again, try to prevent it spreading to others. But a lot of common symptoms we see with the flu is fever or feeling feverish or chills. Not all people get a fever, but that's just so you know. Like some people well, I couldn't have had it because I didn't have the fever. As you mentioned, not every single symptom is going to happen for every individual. It affects people a little bit differently because each individual's body is so different. But we would have that fever, cough, sore throat, a runny or stuffy nose. It could be either way. Muscle aches or body aches are common. Headache, fatigue. And then a lot of times with children especially, we'll see vomiting and diarrhea. So definitely especially if you have a child with vomiting and diarrhea, you want to make sure they're getting electrolytes and they're not getting dehydrated. Because if you're sick and you're not feeling good with the flu, if you get dehydrated, it's just going to make you feel worse. And you could end up in the hospital if you're not properly taking care of yourself.
And I think for adults, you can certainly, it registers how important it is to stay hydrated. But if you have a sick child, it's very difficult to tell them they need to drink, especially if they have an upset stomach. So,
yes.
But it is very important that they stay hydrated. So I guess there's I don't want to say there's a fine line to walk, but you really have to encourage your child that fluid is important. So I think Pedialyte is used a lot. I think Gatorade is used a lot as well. Water.
Yeah, so you just want to...
But you mentioned electrolytes, so there's no electrolytes in water, though.
Not in water, but it is still important that they're taking in water as a beverage. A lot of times those electrolyte drinks are reserved for athletes who are really working hard. They're exerting a lot of energy. They're sweating out fluid. So that's like a replacement. I always like to say with electrolyte drinks, make sure you look at that label to see what's in that product, because some of them could be loaded with sugar as well, which is obviously you want to take sugar in moderation. But you mentioned the brand Pedialyte. They have, and I'm sure there are other companies out there at this time too. They make a lot of options, so different drinks, like liquids that taste good for children, so they're less sugar than some of the competing sports drinks, and they're flavors that your child might like and enjoy. They also have different like freeze pops, lollipops, so there's lots of different ways to kind of, I shouldn't say trick your kids into drinking more
No, I
fluids.
get it. I was thinking about the freeze pops myself, and I'm not a kid.
Yeah, even as an adult, you don't have to be a child to have that. Definitely, if I'm feeling sick at home, we stock up on our Pedialyte because it's a great thing to have in that instance to help us not get dehydrated.
Very good. We agree. Let's talk about how the flu spreads. Obviously, person-to-person contact.
Yeah, so it is a droplet transmission. So what that means is like it spreads when a person who's infected, when they're talking, sneezing, coughing, singing, whatever they're doing, that in their droplets, so in their saliva, that is spreading through the air.
So just to make a comparison, when, and again, it's not totally over, but the pandemic is over. COVID, the distancing signs used to be at 6 feet. So was that determined that that's kind of the distance that I suppose droplets could spread?
Yes. So it all depends, because of course they had other mitigation strategies. So like in some instances that was like 3 feet distance if they were in school. But typically it's 6 feet, 7 feet, especially if you're ill. Keep your distance from others. Limit, especially if you know someone who's immunosuppressed who would get really sick if they got sick. Try to stay away from them. If you have to be around them, wear a mask, wash your hands. And you want to think, even when you're coughing and you're sneezing, you teach children to cough into their elbow, and that helps if you, instead of coughing into your hands, where we use our hands so often, that way you're not coughing into your hands, touching surfaces, and that allows that virus to spread to others.
Because it does remain active, the virus can remain active on a surface for some time.
Yeah, so depending on the surface, but like if it's a hard surface, it can last like up to 48 hours. Studies have
2
shown.
days.
Yeah, so that's a long time. And especially you think of how busy, especially fall time, if you have young children at home as well, you think of how busy you are, like shuffling kids to school, to football practice, to band, and you're in and out, you're touching the doorknob. Our lives are very busy. Even if that's not your life, our lives are busy, and you kind of forget about it. Like you touch that doorknob so many times. Every visitor that comes to your house touches your doorknob. So make sure you're sanitizing and cleaning these surfaces that are always touched.
And I know we've spoken about this in the past, but I guess the avenues, the passageways for you to actually get the infection, if the flu virus is on this table, I touch the table and I touch my eye,
Yes.
that's one way of getting it into my body.
Yes, any of your like mucous membranes, because even your skin absorbs, it would not absorb a flu virus. You wouldn't get it from just your hands. But if I touched a surface where that virus was, and then a lot of us, and hopefully going through the pandemic, people a little bit more vigilant of like what they're touching. But a lot of times you touch a table and then you rub your eyes or you rub your mouth, and those mucous membranes do absorb the viruses. So you can get very sick. You want to make sure you're not touching your face with dirty hands.
Right, so your eyes, your nose, and your mouth.
Yes, because those are all mucous membranes that can absorb.
Very good. Let's talk about what is new this flu season.
Yeah, so I will have the slide pulled up for this section because basically there was been one update to the composition of the flu vaccine, and that was in regard to the H1N1 component. So they updated that to better match what they are estimating will be circulating in the U.S. for this season. But other than that, so that is both for the egg-based vaccine and the cell or the recombinant-based vaccines. So that update was the same for both of those. And also another update that has changed, when we provide a flu vaccine, we are mandated to ask a series of questions. Actually, when we are documenting a flu vaccine, I have to document these questions along with that vaccination. So that way, God forbid if there was a reaction, we could go back and say, we asked if they were sick, we asked if they had an egg allergy, you got to ask if they had Guillain-Barré in the past. I should quickly mention Guillain-Barré it can be rare. It is a side effect some people may see from a flu vaccine, and it does give you temporary paralysis. So it is very frightening. If you had that in your past, they would advise you not to get the flu vaccine again. But what they changed this year is people with an egg allergy, you're now able to get any flu vaccine, whether that is the egg-based or the cell-based. So you can get any vaccine as long as it's like for your appropriate age. Like you couldn't go at 40 and get the 65 and older dose. But you can get any version of it. And you can get that in an inpatient or outpatient setting. Previously, if you had a severe egg allergy, so they considered that any reaction that was more than just hives, because a lot of times people will see hives and it can be a very minor reaction. But if you went into like anaphylactic shock from a flu vaccine, check in with your healthcare provider before you get it. But they used to, in previous years, if you had a reaction more than hives, they'd make you go to your doctor's office to receive it. And now you don't have to do that. So if your local board of health has a flu clinic, you can go there because with the flu clinic, you still have staff. The staff that's vaccinating, they're also educated and they can identify a reaction quickly and also provide treatment quickly if needed.
And I know this has something to do with how the vaccine is, I guess, put together. Mm-hmm. But the whole egg component, explain that.
So the egg component, so it's basically that's how these viruses are created. They use like an egg to do that. It used to be, I believe, I shouldn't say this for a fact, but I think most vaccines used to be egg-based, and then as we've advanced with technology, now it's more cell-based and it's more created in a lab. In that way, like it has reduced the egg allergy. Because like back in the day, if you had an egg allergy, they would advise you not to get the flu vaccine.
Right.
So we've come a long way.
And as we had mentioned, you had mentioned the concern again with, the concern that anyone has. It's not to jump on the computer and try to figure it out yourself. It really is to consult with your primary care. Yes,
and you can also reach out to like pharmacists. They're very educated on all medications and vaccines. You could reach out to your local board of health. We can help advise you because we do have access to the state database where we document vaccinations. So we are able to kind of see a glimpse of what vaccines you have as long as your information's uploaded by your doctor. But in some situations, if it is more of you have risk factors, sometimes if you call your local board of health, we can give you the guidelines and the recommendations by the state and the CDC, but we may sometimes refer you to call your doctor directly. Because your physician knows you, they know your risk factors, they know your medications. So that's why a lot of times we refer you to your doctor directly.
Let's talk about the supply. Any concerns with the supply of the flu vaccine for
Yes.
this particular season?
Yeah, so I got this information as well as what's new for the flu season. I got this information from the Center of Disease Control, so the CDC. So according to that CDC, vaccine manufacturers have projected that the U.S. will be supplied with approximately 156.2 million to 170 million flu vaccines for this upcoming season. All of these vaccines will be quadrivalent, which just means they cover 4 components, so 4 different strains. And then also most of these vaccines will be, I hope I'm pronouncing this correctly, it's thimerosal free or thimerosal reduced. So 91% will be reduced in that. And what that thimerosal is mercury. So like back in the day, we saw a lot of mercury with like vaccines and different healthcare equipment. And now as we're educating on like the side effects and all of that, we're kind of stepping away from that. So you will see there is reduced mercury in 91% of vaccines this upcoming season.
I remember thermometers used to have mercury inside, so if they broke, the mercury would come out. Now thermometers are digital.
Yes, so that, and even you're not advised to even use a mercury. So if you do find one of those, contact your local Board of Health to see where to dispose of it. Because I don't, off the top of my head, I'm not sure how to dispose of it, but your local Board of Health can do a little research to figure out what to do with those
Very
old
good.
household materials that are no longer advised.
We thought they were okay, but they're really not okay.
Yes.
Well, as more is found out, I suppose, as more research is done. Let's talk about prevention. I had mentioned that that's really the key.
Yeah, so always the key. So the CDC recommends the best way to protect yourself from the flu is your annual flu vaccine. So this is the first and most important part of protecting yourself. And this is advised for anybody 6 months old and older. So if you have an infant under 6 months old, they're too young to get vaccinated. So you would just kind of use your discretion to make sure you're practicing hand hygiene, keeping yourself healthy, keeping your family healthy. But definitely, when in doubt, if you don't know if you're able to get that vaccine, call your doctor or call your local Board of Health and we'll be able to advise you. And we'd also be able to advise on local clinics that might be going on in your city or town, or like different pharmacies. We've definitely helped people schedule appointments if they don't have a computer. That's where we're running into some individuals are running into issues with that because everything's transitioning to all online. And I have individuals come in, they're like, I don't even have a computer.
My mom doesn't use a computer, so she would be one that would be stuck, I suppose.
Yeah, so
if we didn't help her.
Yeah, I always let the Quincy residents know, especially at the Kennedy Center where I'm located, my office. I always say, when in doubt, check in with us. If we can't help you, we'll refer you to someone who can help you. So local Board of Health is always a good resource for that.
And what about pregnant women?
So pregnant women, it is safe to get that vaccine. You are advised to still get that vaccine. But if you're concerned, definitely check in with your pediatrician just to make sure you have no other risk factors that they're advising you not to get it.
And then you and I talked about, when we talked about the other illnesses, RSV and COVID, and shots being administered for both.
Yeah.
talk about what a person can receive at the same time and what they would have to make another appointment to receive.
Yes. So, as many people may know, there is an RSV vaccine now available this year. So what they're advising as far as the RSV vaccine, the COVID-19 booster, and the flu vaccine, you're advised to get all three because, of course, the flu vaccine doesn't help you with COVID and vice versa. That RSV vaccine does have to be administered by itself, and you would want to wait at least 2 weeks before getting your COVID vaccine or your flu vaccine. So definitely keep in mind, we are kind of seeing right now too with the updated COVID booster, due to that, there was that potential government shutdown that was going on the news last week. So with that, the funding for the vaccines were paused because things were in limbo. So the rollout for this new booster is a little bit reduced. It's not coming out as quickly. So even though you look online and your local pharmacies say they have the COVID vaccine, they might not have the most updated booster. I believe it was as of September 2023 that they're advising you, if it's been 2 months since your last booster vaccine, you should get this updated one. But we've been getting a lot of calls in the department because people are making appointments and their appointments are being canceled because those facilities haven't received that updated vaccine yet. So definitely try to hang tight, reach out to your local Board of Health. If we don't have that information, we're saying check in with us next week. We're giving out our phone number. We're trying to stay on top of it as soon as we get the information from the state.
I guess we only have 2 minutes, so I do
yeah.
want to get to the rest, but clean and disinfect surfaces.
I had mentioned this. Make sure those frequently touched surfaces, your doorknobs, your tables, especially your cell phones. You don't think of that. You walk around all day with that cell phone. You're touching everything, and then you're touching that cell phone, and then you're laying in bed still holding that cell phone. So make sure you're cleaning and disinfecting. It's important to know when you're disinfecting those EPA registered disinfectants. Make sure it kills the type B influenza virus. And make sure you're following those instructions to keep yourself safe while using them. And then the rest of these prevention, it's common sense. Avoid close contact with others, especially if you're sick or they're sick. If you're sick, stay home. Cover your nose, mouth when you're sneezing or coughing. Wash your hands. Sing that the happy birthday twice. Make sure you're using warm water and soap. That's always the best. If you're away from home, I always like to keep a hand sanitizer in the car, and I use that until I can get to a sink to wash my hands. Again, avoid touching your eyes, nose, and mouth with dirty hands. And overall, practice good hygiene. So make sure you're hydrating, healthy diet, getting physical activity, adequate sleep, because your overall health, if you're implementing all of those measures to keep yourself healthy, it will help your body and your immunity fight these viruses.
Very good. A great show. I want to thank you for coming in and sharing your information with the folks here in Quincy and beyond.
Yes, thank you so much for having me again.
You're welcome. And thank you at home for watching. And please remember to continue to support local access television in the community in which you reside.